And just to show you that at NCDC, we are telling you so many outbreaks now. That is the peculiarity of our country. And some of these outbreaks are still killing people much more than Mpox. This is not to emphasize Mpox because we have issues here. So first of all, if you look at this map, Mpox map here, unfortunately, the map as at the last time we gave you, the August, this is when it started. This is what it shows. You see the yellowness. It's not as many as what we have now. It goes to show that we are having an increasing number of cases of Mpox in the country, confirmed. From the last time we said about 39, when it came about, now we have 67. So they are on the increase. More states are reporting, like we said, only one state in Nigeria now has not reported a case of Mpox, and that's Borno. And we're trying to find out the reasons why. Most likely it's been underreported, and so we have to be careful. The interesting thing about Mpox is that historically, from studies that have been conducted, if you recollect the last time we had an outbreak, a period of 2022, that was before I came here. That's where we had a large number of cases then, over, I think, I can't remember, now, more than what we are seeing now. Majority of these cases now, if you look at that map, they started right from the south and southeast part of this country. And they started moving up to the central, north central, now to the northwest and northeast. That's how Mpox has been moving. Now, historically again, some reports have said that the first cases maybe came from Abia State, they were not detected, they moved to Port Harcourt, where the first of few cases were detected, and from there now they started moving around the country. If you look on the left, Ogun State, that's the southwest, and Lagos, we have cases. So what this means is that whatever response we are adopting, it has to be very, very collective and comprehensive. Yeah, going northeast and to the northwest, I think Kaduna, to boost the laboratories there to increase their capability to be able to detect Mpox, so that people, you don't have to carry samples over long distances. That's one. In addition, again, we are training the staff again in those laboratories in those states to be able to detect this thing. More important is awareness creation, and that's why part of this we'll be talking about how Mpox is presented, what Mpox is, how it is presented, what we can do to prevent the transmission. We'll continue to do that as we go along. Now, specifically again, we're talking about cholera. Cholera, luckily, so that it's on a decline. The case of cholera on the decline in the country right now. We are seeing more. Sorry, let me just get my facts right. Yeah, there's a declining trend in the number of suspected cases of fatalities. And of course, again, fewer states now are reporting cases of cholera. But we should not rest on our oars, because one, we still have the rainy seasons, and two, remember the flood recently now. And flooding also have the health consequences. Flooding can increase the number of diarrhea cases, it can increase the number of cholera cases, gastroenterology, typhoid cases, even malaria cases because of mosquito transmission, typhoid, hepatitis, dengue fever. These are the diseases that flooding can actually increase or cause. Again, you have because of water runoff, this runoff can again introduce chemicals from the ground that can be pollutants, that can be detrimental to the health of the people. And once they come together, they can cause other things. You have industrial waste that this flood can actually push and carry again. This is how they make people more susceptible to the health consequences of flood. That's why it's very essential for us again to address this issue. Both states now should get ready, especially in Borno State where we have this. Our staff are working with NEMA now again to help address these issues. We mentioned the case of diphtheria. That's because, again, like I said, over the years again, we are still having many cases and many deaths, and we are not happy about it. These are vaccine preventable diseases, and the message basically now is that we must ensure that our children are vaccinated, or the people are vaccinated at appropriate times again. The last bit again is, I say, prepare for the seasonal diseases, and that's why we mentioned Lassa fever, meningitis again, and some of these cases. Lassa fever is on the decline, meningitis is on the decline because we have been advised to deactivate the EOC. But again, we also know that this is a seasonal, and very soon the will start coming up. We're expecting Lassa fever to be on the rise again in the next couple of weeks. Meningitis again will peak again towards the beginning of next year. So right now we should start preparing people, masses again, to ensure that we can put down all those cases. I mean, all the strategies that we need for preventing disease, so that we do not record as many cases as recorded in the current year and the previous years. And of course, in preparing again, this general thing again, we stockpile materials we need for whatever it is when this thing occurs, in terms of medicines, in terms of PPEs, in terms of whatever materials we need, medical countermeasures. We increase our public awareness. So in the next couple of weeks now, we are going to increase specific public awareness with respect to Lassa fever and meningitis, so that this will be sustained, so that we have to prepare the minds of the people again. We also do know that in the next couple of weeks and 2-3 months, because this disease are seasonal, we are likely to be seeing increasing cases of those diseases again. So it is now incumbent on us to prepare now, to start preparing for situations and strategies that will not allow us to see as many of those cases as possible this next season. If you go back to data, this year alone, Lassa fever cases, meningitis cases were more in number and death rates this year than we saw the previous years. We do not want that to happen again in the next season. So there is a need to start taking precautionary approach, preventive approaches now, before they get at us. So we'll brief you on that. The last bit, we know recently, but was it yesterday? They had this flooding situation with the Bus Dam in the northeast, Borno State, leading to severe flooding. It's also our intention again that to let people know the health consequences of this flooding. So like Tariq said, I don't know what system again?
Yes, so the incident managers and technical teams are going to give a breakdown on each of the disease aspects that were.
I can't look at somebody and say, oh, this person is suffering from antimicrobial resistance. But people will be sick with infectious diseases. It is, as Jide has just pointed out now, they'll be receiving different courses of antibiotics, but it will not be working. And we know how our death registration in this country, there'll hardly be a death certificate that will say cause of death, antimicrobial resistance. And that is why, for you to get the real picture, the real body of antimicrobial resistance as per mortality death, you have to go back into records in hospital. To the point you mentioned, the ones you mentioned attributable and associated, you have to go really deep in some technical detail, which I won't bore you here. But what is more important is your question of what we are doing to bring this down. Because we are just not talking about the problem. The plan is that we'll first of all put a brake on this and then begin to reverse the impact of antimicrobial resistance. And the impact is in the form of people dying of antimicrobial resistance. But like mentioned, it has to be done in an organized way. Human health can't do it alone. Animal health can't do it alone. Environmental health can't do it alone. So we first of all have to come as a country and organize. That is why NCDC is leading the coordination of AMR response. But we need to reduce the burden of disease, because any infection you don't have to treat is one more infection you don't need to use antibiotics for. So we are working hard in raising awareness, working with every possible stakeholder we can identify to reduce the burden of infectious diseases. And what are the easiest ways to do that? The cleaner we are as a society, the less the burden of infectious diseases. The more access we have to water, sanitation, environmental hygiene, the less infectious disease we have to treat. So we welcome everybody to continue to spread that message of making our society a cleaner one. And then in hospitals, we want to make sure that even if somebody with an infectious disease that is resistant to antibiotics comes to a hospital, that becomes the end of the transmission of that infection. So we are working to build resilient hospitals where people can come to get treated, even if it's a multi-resistant organism, but more importantly, not pass it on to other people in the hospital or take it to community. These are the ways we are working to reduce the burden. But access to even antibiotics, a lot of people are still dying of infections that we even have antibiotics that can treat them. But because of maybe poor access to hospitals, or people just simply having poor health-seeking behavior, could be because of family barriers at the level of community, they are not even able to go to the right hospitals. I mentioned people going to chemists to say miss medicines for me. These are the things that will then continue to push infections from one person to the other until it becomes resistant. We're also working with colleagues in the animal health sector, because a lot of antibiotics that continues to put the push and the pressure on antimicrobial resistance is used in the animal health sector, the food and agri sector. So we're all coming together, brainstorming, working hard, very intentionally. Is it through regulations? Is it through policies? Is it through training and capacity building? Whatever is required is what we're doing together to address it. I don't know if that answers your question. Thank you.